I really want this facility to be shut down to stop practice.
The mental health chain at the center of an 8 on Your Side investigation has agreed to pay close to $20 million in fines. Federal prosecutors reached that deal with Acadia Healthcare over allegations that the company submitted false claims to Medicaid and Medicare. Former patients and employees told us people were held against their will at Acadia facilities, including the one in Pasco County. They claimed the motive was not patient care, but rather profits. So will this fine bring about change? Investigator Brittany Muller joining us now with the latest on her story.
Keith, good evening. William Crowell says he was held against his will for 10 days at North Tampa Behavioral Health Hospital and Wesley Chapel. The company that owns the hospital now has to pay a nearly $20 million settlement, but Crowell says it's definitely not enough for his mental anguish that he endured.
William Crowell says he came to this Pasco County hospital in a moment of crisis, but claims that the company that owned it had something else in mind.
It's a place where you can bill someone if they're insured. I mean, that's really all that they're interested in doing.
In August of 2021, Crowell says he was going through a tough time, so he called the National Suicide Hotline. Pasco County deputies showed up at his door, and citing Florida's Baker Act, they brought him here to North Tampa Behavioral Health Hospital in Wesley Chapel.
I wanted to be released after the 72 hours. I found that very difficult to do. I was told by staff if I were to consult an attorney that they would extend my stay another 3 days.
Crowell says his insurance company was ultimately billed more than $20,000 and claims he was kept long after his crisis had passed.
I really feel like they need to be shut down permanently.
It's not the first time that Acadia Healthcare, which owns North Tampa Behavioral and more than 50 other psychiatric hospitals nationwide, has faced accusations of keeping patients longer than medically necessary. The U.S. Department of Justice alleges that Acadia knowingly submitted false claims for payment to Medicare, Medicaid, and TRICARE between 2014 and 2017. Prosecutors say Acadia admitted to, quote, improper and excessive lengths of stay and, quote, knowingly failed to provide adequate staffing, training, and or supervision of staff, which resulted in assaults, elopements, and suicides. Under a new settlement agreement, Acadia will now pay nearly $20 million in fines.
Is that enough?
I don't think so, because there's just too many loopholes that they can take advantage of to keep people there, to keep insured people there.
We asked Acadia Healthcare about the allegations against them and the settlement. A spokesperson tells 8 on Your Side the company has been cooperating with the government since it was brought to their attention in 2017. Acadia also shared this statement saying, in part, quote, the agreement includes no admission of wrongdoing or liability and resolves historical matters, which allows us to ensure our focus remains on providing quality care to our patients and their families. But William Crowell says people in crisis may be better off going somewhere else for help.
It makes me very reluctant the next time that I want to reach out for help. You're better off to seek a church, a synagogue, what have you, instead of actually going to a facility.
If you have a story that you would like to share with us about North Tampa Behavioral or Acadia Healthcare, please email me. I would like to hear from you. In the meantime, the DOJ says you can report tips and complaints to the Health and Human Services. The number is 800-HHS-TIPS.
You mentioned the federal investigation covered 3 years, 2014 to 2017. What about the more recent allegations?
That's a great question, Keith. I reached out to the DOJ as well as the FBI. They say they are declining to comment at this time, but Acadia Healthcare tells me yes. The company's CEO says it's adding new roles and allocating $100 million to advanced technology. But the former employees and patients that I've spoken with say what the company really needs to do is let Acadia's mental health clinicians call the shots when it comes to patient care.
Not the bean counters, the medical personnel.
Correct.
All right.
Thank you.
Thank you. If you have something you want Brittany to investigate, call our 8 on Your Side helpline at 1-800-338-0808.